Hello, welcome back to the training for the healthcare policy for RISE Early Education Academy, and also known as BUCA Kids Center. We've already covered basic information, emergency contacts, vaccination requirements, children's documentation during registration. We've covered illness, injury, and emergencies. We've covered managing and reporting infectious diseases. We've covered plan for mildly ill children. We covered first aid, transportation to a hospital. Now we're going to cover emergencies while on a field trip. We don't do too many field trips, but then again, we call our walking to the playground similar. So keep that in mind. And if an accident or an acute illness occurs while on a field trip, the lead teacher will take charge of the emergency, assessing the situation and give first aid as needed. The method and urgency of transportation for the child to receive medical treatment will be determined by the lead teacher based on the severity of the emergency or illness. So if necessary, an ambulance will be called. The program director or other designated adult will be contacted by the head teacher as soon as possible, informed of the nature and extent of the injury and the proposed plan of action. As a preventative measure, prior to departure from the center, the program director and/or lead teacher will determine appropriate guidelines to be followed during the field trip to ensure continuity and safety of the child or children, including a first aid kit will be taken in all vehicles on all field trips or walking. We take the blue backpack, and that has an emergency first aid kit. 2, emergency information, including contacts and telephone numbers, will be taken on all field trips or a walk to the playground, and that is included in the blue backpacks. 3, on a field trip, staff must have a working cell phone available. If I go to the playground, I usually have both my personal and my work cell. I know Natalia does too, and Natasha, she usually has her cell phone. So Susha usually takes her cell phone. So we all mostly take our cell phones, and it's a good idea if you do. Plan for injury prevention. To prevent injury and to ensure a safe environment, the staff member who opens each classroom is responsible upon arrival each day for monitoring the environment and for the removal of any hazards. Check your room. Any needed repairs or unsafe conditions should be reported to the director or taken care of. The staff member will monitor the outdoor playground and remove any hazards prior to any children using the space. That may be hard to do, but if you see anything in that playground that's hazardous to our children and other children, please remove it, put it in the trash can. No smoking is allowed on the premises. No smoking in the playground. Toxic substances, sharp objects, matches, and other hazardous objects will be stored out of the reach of children. So again, this isn't on a field trip. This is in the building as well as out. So we're looking over the classrooms, we're looking over the hall, and we're looking over the playgrounds when we get there. A first aid kit and emergency contacts and telephone numbers for the children will be taken on all field trips. We talked about that. An injury report for any incident which requires first aid or emergency care will be maintained in the child's file. I also keep a binder for any incidents. So the blank incident reports are in this binder on the cabinet, on top of the cabinet where you do your timesheet. I think it's a blue folder. And right in the pocket of that blue folder is a blank emergency form with our incident form with our childcare number, ID number. So on there, be sure to fill it out completely. Be sure to write the date and the time of the incident and the location. That's most important, and tell about how the incident happened. And then that is given to the parent at the end of the day, and it's also signed by myself, and then we file it in the child's file. So, once the program director has reviewed the accident report and has signed it, it should be given to the parent. Again, the parent should be allowed to review it, sign it, and then be given a copy. A lot of times the parents refuse a copy. They don't need one. You can ask them if they want one or have one already prepared and they sign both. The staff member should then log the report in the central log of injuries and then file the report in the child's file. If you don't have time as a staff member to log it, please put it on my desk and I'll log it. Only staff who have current first aid will be allowed to administer first aid no matter how minor the injury is. And a current first aid, it's usually a CPR first aid certification. It's taken every 1 or 2 years, and we all should be updated on it. So please take care of that. Be sure that there's one scheduled or you go to a first aid, CPR first aid class. Assessing injuries to children in care. According to the National Safety Council, injuries are the #1 health and safety problem for children in child care settings. When a child is injured, child care providers need to fully assess the child's injury and make sure they're following the first aid procedures. In addition to following proper first aid protocols, the office recommends these additional procedures to be followed when a child needs first aid. When an injury occurs, ask the child questions and observe to make sure the child is okay. Monitor the child throughout the day. Continue to assess the child's injury to make sure what was first observed and treated is still the appropriate course of action. Note, anytime you believe the child's life may be at risk or you believe there is a risk of permanent injury, seek immediate medical treatment. Call for immediate help, 911. After first aid is administered and the child is calm, the administrator or teacher should survey the scene and gather additional information. What was the child doing? What equipment was involved? Was another child involved? Were there any hazards involved that we could plan ahead and take care of? Were there any witnesses? And what did they see? Procedures that must be followed are, again, the complete an injury report, provide timely, full, and accurate verbal notification to parent, guardian regarding the injury, do not perform first aid or CPR without having completed the training, regularly reviewed programs, healthcare policy among us. That's the policy that we're doing now and in this white binder. And I do update it once in a while. If I update it, I will update this training as well. Program staff must share all pertinent information with program administrator and any teacher taking over care. Share the child's status with the parent guardian at pickup time. Make sure the location of the child's medical information is complete and accessible to staff. Procedures to follow in an urgent emergency medical situation. Administer first aid and CPR to the child as deemed necessary based on the nature of the emergency. Call emergency medical services right away, 911. After EMS or emergency medical services have been contacted, call the child's legal guardian. Take child's medical information and emergency consents from the files, the child's files, to the doctor's office or the emergency room. So, this is for an urgent emergency medical. And at all times, make sure that we have the correct ratios for the children who are staying at the center or are at the center. So it's going to have to be a quick decision, decide who's staying, who's going, is the parent coming, the guardian coming, and where's the child going? how are we taking care of the child? Management involvement. Number 1, know how to access emergency medical services, EMS, in your area. How do we do that? 911. Educate staff on, okay, this is for the management. Educate staff on the recognition of an emergency and the center's healthcare policy. That's what we're doing now. We have the book available, but now we have this video. Know the phone number for each child's guardian and primary healthcare provider. Oh, that's interesting. So those numbers are in the child's files or online. So I'm not necessarily sure that I know the primary healthcare providers. I may know the phone number for each child's guardian. So I would have to, again, go to the files and look up the primary healthcare provider. Share specific plans and specific healthcare needs of children with direct care staff. Develop plans for children with special needs with their family and healthcare provider. So those are the things we do as a center, as a licensed center, that the management does with their staff. If there's any questions or you have concerns about those, let me know. Okay, so we're going to talk about medication administration and health plans. So an individual health care plan. An individual healthcare plan is essential for managing the health needs of children with specific medical conditions, which has been diagnosed by a licensed healthcare provider, as required by 606 CMR 7 11 3A to C. So there are regulations that the EEC has put out that each licensed center has to follow, and these regulations are the 606 CMR 7, and so, or 606 CMR, and it's under 7.11.3 that it says and talks about the IHCP. The program will develop an IHCP in collaboration with parents and guardians, school-aged children who is 9 years or older when appropriate, program educators, and the child's licensed healthcare practitioner, who must authorize the IHCP. These forms are important. They're critical. We follow them. They need to be updated annually. And if they're not updated, we can get written up on the non-updated IHCP. Currently in our center, we have one child with an IHCP, but there has been times when we had more. So it's always important to find out which child has an individual health care plan, because there's a potential emergency right then and there that may happen. So the IHCP must include the following: a description, number 1, description of the chronic condition which has been diagnosed by a licensed healthcare practitioner. 2, a description of the symptoms of the condition. 3, an outline of any medical treatment that may be necessary while the child is in care. 4, description of the potential side effects of the treatment. 5, an outline of the potential consequences to the child's health if the treatment is not administered. Sorry. So an educator will successfully complete training relative to a child's IHCP. This training must be given to the child's healthcare practitioner or with the child's healthcare practitioner's written consent by the child's parent or the program's healthcare consultant. In other words, if we have an EpiPen, we need training by someone. Who's that someone going to be? It could be either our healthcare consultant, it can be the parent, or it can be the primary practitioner. The training must specifically address the child's medical condition, medication, and other treatment needs. Some examples of an IHCP would include children with asthmatic conditions, allergy reactions, ADHD, or diabetic conditions. IHCPs are not required for children without chronic conditions, needing oral or topical medications. So that's a separate, and we'll talk about that if a child has been sick and needs, or something is happening and they need medications during the day, we'll talk about that. In the event of an unanticipated, non-life-threatening condition requiring treatment, as specified in the individual health care plan, Rise Early Education will make a reasonable attempt to contact the parent guardians prior to administering the unanticipated medication or beginning the unanticipated treatment. If parent or guardians cannot be reached immediately, they should be notified as soon as possible after the medication or treatment has been administered to the child. So if the EpiPen is needed, we contact the parent, but if it requires immediate, we give the EpiPen. There's no harm in giving an EpiPen if it's not needed, so that doesn't even have to be thought about. You give the EpiPen, and then you notify the parent or guardian that the EpiPen was given, or other medications. Let's see. Educators must ensure that they document the administration of all medications and medical treatments in a child's medication or treatment log. That log is usually with the medication. Written parental and licensed healthcare practitioner authorization is valid for 1 year, unless withdrawn sooner, and must be renewed annually. Again, the IHCP is for 1 year only. And when the child's condition changes, for administration of medication and or treatment to continue. So it does expire, the medication expires, the IHCP expires, and it is updated or changed if a condition happens in the child. If the child is no longer allergic or the child no longer needs the medication, then there will be a change in the IHCP. Copy of the IHCP is maintained in the child's file. It's also located in the backpack of the classroom the child is in. So currently we do have a child with an EpiPen. This package is in a Ziploc bag in the backpack. It has the log, it has the IHCP, it has parent signatures, it has healthcare practitioner signatures, and it has non-expired medication. Okay, so we're going to stop for now, and next we'll come back and we'll talk about medication administration, who can do it, when, where, etc. Okay, take care.